at 104 over 65, and your pulse is 87. So you want this one ideally to be under 120. So you're in the normal range, which is great.
Okay, he's just gonna register you, and then we're gonna have a seat on that side when he's done.
That was fast. I didn't even feel it.
She hears mom's voice, she's like,
I think we all want the same thing. We all want our communities to be healthy. We want to see our children grow. We want to see our families happy and thriving. To have a community health improvement plan that's based off of a community health assessment really allows us to be grounded in what is most important, not just to the city, but also to the community.
Right, we all took that on honestly.
And define the intentions of where we want to go together in the next 3 to 5 years.
If we want some of these objectives to be met, kind of hinges on the strength of the partnership.
JSI was brought in basically to be facilitators in this space. I think a lot of what we do is hear from all these different perspectives, whether it's a community survey or a focus group or a community steering committee meeting, talking with the staff at City of Berkeley, and then synthesizing it and thinking about, okay, how do we talk about what happens next?
It was a learning process for the steering committee, understanding the data that was available, what resources and programs were already in place.
What objective do we have within the workforce domain? It's been amazing to see the really detailed underpinnings of what it is to build and to develop a city, but also how do you make change in a city? How do you uproot the things that no longer work, and how do you plant the things that you hope will? And that's a really, really meaningful process, and not one that I had been able to kind of participate in before.
Y aquí tengo las recetas, y entre más fresco, mejor y más saludable para nuestros corazones.
One of our core values for the city, this department, and for the public health division is that community voice, is that community drives
There you go. Now
the things that we develop and the programs we develop to serve them.
We talk in public health about how health is connected to so many different things, but being a part of this process, we really saw what that connection looked like, where all of the health priorities that rose to the top were behavioral health, community safety, environmental health, and housing. And none of those are like directly physically health related, but are all interconnected to what people feel like they need to be able to thrive here.
The focus areas this process identified isn't something that just the health department can work on in isolation. It offers an opportunity to invite other departments and other community-based organizations to join us in this journey.
These relationships and these collaborations are going to be even more important moving forward. We're definitely going to need the support of council and city leadership, and we're definitely going to need the support of our community members.
in working side by side with some of the folks across departments in the city of Berkeley, there is an extra level of passion and dedication that I honestly will say, to be totally open, wasn't really expecting. What I saw was people continually inspired by their work.
And how it kind of took a life of its own.
It's energizing to know that they're really receptive to the ideas that we were bringing forward.
I just feel like my voice is heard. As we've been discussing, like, you know, how are we going to integrate this? What do we have to consider? Is this going to affect a different demographic that we didn't think about? I love that I can see the tangible results coming through.
I think, especially the way the world is right now, you can feel really powerless. And I would say yes, and get involved locally. These kinds of projects can help you build community and have impact.
We need to center community members in order to understand the story. And then the second part is actually to understand what the right solutions are. And that was really important for us in the centering, was that community members be at the table to say, okay, so if we think the problem is displacement, for instance, in Berkeley, what are potential solutions? We want to come up with ideas that are actually going to make a difference and move the needle on some of these issues, but we want to do it in the realm of what's possible and not just say, this is what should happen and demand that the city do something, but rather have this dialogue with people who are really embedded in these systems so that they're more feasible.
We really need to remain attuned to what the community's needs are, because they're going to be evolving, they're going to be dynamic, and we need to be able to be dynamic with that. The only way to do that is to listen to them.
As health assessments and health improvement plans become more of a standard part of the planning cycle in California communities, creating that space for trusting problem solving together is sort of the essential thing.
I just think that it's really important that if you want to make that change, you got to be a part of it. And that's why I love Berkeley so much, where there is that huge sense of community and commitment to one another. When a group of people fall down, there's another group who's trying to lift them up.